So what about this argument, Dr. Aliabadi, that we don't need that vaccine because regular feminine health screenings, they're going to suffice. And I'm taking my teenager, or I'm telling my teenager she needs to go to these screenings and she'll be fine without the vaccine.
This is the most common sexually transmitted infection in this country, and it affects 80 million people in this country are currently infected with HPV, and every year 14 million new patients are infected with this virus. The HPV vaccine is considered a preventative care. It's not a treatment. So if you don't vaccinate, by the time patients show up to my office and they're already infected with the virus and they have precancer cells and they have genital warts, then I have to treat the disease. So the point of this vaccine is to block these patients from getting infected, and hopefully they won't need the treatment. So I just want to make a point here to one of the most common questions people ask me in my practice is, if they get infected with the HPV virus, do they still need to get vaccinated? And the answer to that question is yes, because even if you get infected with one type of HPV, you still want to protect yourself against the other types.
So Dr. Aliabadi, there's a recently very interesting development that 5 states mandated the HPV vaccine for school attendance. What are your thoughts about that?
I think if you educate patients, they're going to end up getting the vaccine. But, you know, in general, I think you have to give the option to parents to make a decision, especially for their younger children. And, you know, we hope that, you know, they trust science and they vaccinate.
So Dr. Offit, what are your thoughts on these new mandates and what do you think about them in general?
In the end, I just don't think it's your right as a parent to allow your child to catch and transmit a potentially fatal disease. I think that it's perfectly reasonable then to mandate it, much the same way that we mandate things like car seats, or we mandate stop signs at intersections. Normally, parents are exactly the ones who will stand up for their children and represent the well-being of their children, but not always. And when they don't do that, then what do you do? And I think it's reasonable for the state to step in and say, look, if you're not going to protect your child, we will.
Well, great discussion, and we were truly blessed to have 2 such great experts as you, Dr. Offit and Dr. Aliabadi. I mean, I learned a lot going through this discussion, and I hope all of you listening did as well.
We're living in uncertain times. It's tough to keep up with the latest medical headlines.
About the market, panicked about COVID.
And how do those headlines impact you and your family? 100,000 people died. On season 13 of The Doctors, we want to empower you physically.
If I met them at dance, they would meet me at medicine.
Man, I love that. Emotionally.
If I can change my thoughts, I can change my feelings.
And medically.
He doesn't have his mask up, which is not a good thing.
This is the $1 million question, maybe the $1 trillion question. This is so critical for people to hear. We're giving you the inside track on health and wellness so that you can get back to the life you deserve. It's time to take back your power. The Doctors, now more than ever. Premieres September 21st.